Good afternoon, everyone. Thank you for joining and welcome to today's webinar. My name is Dee Ryan. I'm the CEO with Limerick Chamber, and we're delighted to collaborate with Optima Training to deliver today's session. My thanks to Adrian Carmody, the Managing Director of Optima Training, and to my colleague, Caoimhe Maloney, the Chamber Marketing and Events Manager, for the work that they've put in to putting together today's webinar. The session is designed as a result of queries that I have been receiving and Caoimhe has been receiving, the office has been receiving from you, our members. So I'd like to thank you for those important communications. We've heard your concerns about refreshing COVID officer training and ventilation and the like, and the government guidance. And so Adrian has put together this session that will touch on all of those and essentially cover the key considerations for employers and managers in welcoming your teams back into the workplace. We are recording this afternoon's session, so we will circulate the video recording to you afterwards. And we will also circulate dates for upcoming training that we're planning with Adrian if you'd like to put your COVID officer on a refresher training course over the course of the next few weeks. We will also be circulating a link to frequently asked questions on vaccinations. So in response to your queries that we were receiving on vaccinations, we reached out to Chamber members, Holmes O'Malley section, and one of their partners has put together a blog post for you on frequently asked questions for employers and managers around vaccinations, what you can and cannot ask, and just some considerations for you there. So without further ado, I am going to hand over to Adrian Carmody to take us through today's session. Thanks, Adrian.
Thanks very much, Dee, and thanks for Caoimhe as well, and for Limerick Chamber Skillnet for having us deliver this session for you on key considerations for return to work. As Dee kind of highlighted there a moment ago, there's a huge amount of different kind of content that we might touch on over the next kind of 45 minutes or so. So many questions have been coming in, so much has been changing in terms of the return to work protocol, about guidance, about self-isolation, about vaccinations. So there's a huge amount, and I'm conscious as well that not everybody will be necessarily returning to work. Some people may have been working all the way through, and we'll try and make that just as applicable to people who have been working all along as for people who are returning to work. So it's considerations for people as we return to work, but also as we, I suppose, come into the next phase of COVID response and COVID return to work. So just a little bit, I know this has been mentioned already, but the session is being recorded and the guys will send it through the link for you there. Caoimhe will send that over. Again, your image isn't being viewed or shared, or any questions you ask won't necessarily be covered on that recording. So the microphones are on mute just due to numbers on the session. And if anyone wants to send through any questions on the chat, please do so. And we'll try and touch on those for the last 10 minutes or so of the session. A little bit about us, and I won't dwell on this. We're Optima Training Consulting. We're based in Castletroy, a member of the Limerick Chamber as well. And we cover all sorts of training courses, quality, health and safety, Microsoft applications, and so on, along with COVID response, GDPR. We do a lot of consultancy services in the areas of which we train also, health and safety, recruitment, and so on as well. Just touched on the courses that we do, so leadership, sales, health and safety, quality, healthcare, Microsoft applications, supply chain. So just a little bit about ourselves there on that. I know I can see some people there on the group that we would work with, so welcome to the session as well. Just a little bit of a recap. Look, we're probably all experts on this. This has been going back since December 2018 when COVID was first notified to the authorities, and it became March 2020 when that became an issue for ourselves. Around the mid-March, that's when the, I suppose, full lockdown would have happened. So we're talking about 18 months ago at this point. Two ways of the virus spread, direct and indirect. So virus can spread, and we probably, as I said, we know this, but direct spread will be from person to person, normally those people who are within close contact. And I've defined close and casual contact over there on the right-hand side. So we hear a lot of talk about close contact. So what is a close contact? It's somebody who is within 2 meters of somebody else for 15 minutes or more. So that's the definition of a close contact versus a casual contact is that person who is in the same area or location as the other person for more than 2 hours. So that might be in an office area, it might be in a meeting space, it could be in a cinema, it could be anything like that. So the same environment, whether it's a workspace or otherwise. And that's then in terms of contact tracing. We'll talk a little bit more about that after a while, why that's important. So that's direct spread, person to person. So respiratory circulation goes from one person to another. And then we have the indirect spread where one person contaminates a surface They might sneeze, they might cough on the surface. Somebody else touches that surface and then touches their hand off their eyes, nose, mouth, for example. And again, they can be infected by that. It's actually more common for that indirect infection. And that's where infection prevention and control cleaning regimes will come in when we talk about facilities management in a few moments. The current statistics are about 365,000 cases in the country, with about 5,155 COVID-related deaths reported. In terms of symptoms, this would have been going back quite a while, but obviously the 4 key symptoms to begin with were breathing and respiratory difficulties, temperatures of more than 38 degrees, loss of taste or smell, and also coughing. Now, with the Delta variant, we came into with new symptoms, so all the things to be watching out for in terms of return will be things like headaches, sore throats, runny nose, fever, and persistent cough. Now, again, as we can imagine, as people come back to office spaces or schools, whatever the case would be, at this time of the year, going into the autumn winter season, then that's going to be problematic. So there's a lot of people going to have those symptoms. They won't necessarily be related to COVID, but again, we have to act as if it is. Now, for people who are vaccinated, I'll give you some more details later on in terms of what that person should do if they're fully vaccinated and if they have symptoms, whether they have to isolate or not. So we'll cover that off in a little while. So there are the new symptoms in relation to the Delta variant of COVID. And again, things that might replicate a normal cough or cold that people would have normally over the winter season. So that's a difficulty, I suppose, as we come back to work. We was just going to pop a poll up, just a question for yourselves, actually, to turn around on you for a moment. Here's a question I have for you. Can I require my staff to return to the office? So as an employer at Optima Training, can I require my staff to return to the office? What do you think? Okay, if I can get you to maybe pop a vote on that, that would be great. Okay, sorry, just the wrong poll is popping up there for the moment. Apologies on that. So it's, can I require my staff to return to the office? Just see if that pops up. And if not, I'll give it a couple of seconds, but if it doesn't pop up, I'll just answer that for you anyway. Okay, so it doesn't seem to be coming there at the moment. But so what I was going to ask, can I require my staff to return to the office? The answer as an employer is yes. Okay, so I have a contract of employment with my staff. I reserve the right to bring to their contracted location, which is the office. Now, it's obviously there's more complicated than that in terms of what I need to do. In terms of the Safety, Health and Welfare Act, I need to provide a safe space for my staff to work in. So I must look after health and safety. I must look after COVID and our COVID response plan, all the other documentation that I need. So I need to make sure if I'm going to bring my staff back, I have all of these elements considered. But in the end, I do reserve as an employer with my contract of employment where the place of work is my registered office, I do reserve the right to bring my staff back. Now, the COVID response plan and the return to work protocol will highlight that it's very much on a risk assessment basis that we bring people back to the office, both on a wide scale basis, so for all of our staff, but also then on a one-to-one basis. So each member of staff separately should be risk assessed. For example, is there any underlying health conditions, any reason why one person might not come back and another would? And we to be very careful then on who we decide who should come back and who shouldn't come back in terms of equality as well and discrimination. So just be aware of that as well. If we have as we decide who's going to return and who's not, and on what basis that is. It might be that there's some occupations, for example, that clearly need to be back much earlier. So, all along, there's been frontline staff, there's been people working in manufacturing, people working in education, people working in healthcare. So it depends on the role and how urgent, I suppose, it is to bring someone back. So some things have changed over the last number of months. Still, some things are still the same. So what's different that people have worked at home now for about 18 months. Okay, so they have different routines, different expectations. A lot of people have very much liked that area of working from home. Some people would like a hybrid response, and we know that from about 86% of submissions in relation to COVID return to work bill, where we're looking for submissions on that, have indicated a preference for a hybrid working model. As part of what we do in the recruitment area as well, under Optima Recruitment, we're finding a huge amount of variety there at the moment in terms of what staff actually want, in terms of, when roles are coming up, what are staff looking for now? They're looking for an element of working from home. They're looking for that hybrid situation where they can work sometimes in the office and sometimes at home. And we're also finding that where employers aren't giving that, where they potentially could, we're seeing that transition of people at work now looking for different roles where that will work. One of the key questions we're asked in terms of that is how many days a week are from home, etc. So again, that expectation has changed around what people are entitled to. If people came to me 2 years ago as staff and looked for working from home, it would have been very much probably, I'd be first to admit it, on a reluctant basis, and we would have agreed something for a very short window of time. That has really changed over the last number of months. So there's also genuine concerns and fears about returning to work. So people have anxiety about returning to work for all sorts of different reasons, but health and safety being a key aspect as well. People haven't been, in a social atmosphere, social environment for quite a while. They might not be going out anywhere else, and we're asking them to return to the office. So we need to be prepared as people do come back, and we need to kind of handle those reservations and those concerns and those safety elements as well. The right to disconnect. That came in the 1st of April. So in a whole suite of changes that are forthcoming in terms of legislation, the code of practice in terms of the right to disconnect means that we have to be very mindful of what we ask people to do outside of their terms and conditions and their working hours. So for example, on the 1st of April, that came in. And it basically means that on a routine basis, we should not have an expectation of our staff to be responsive and to be responding to phone calls, emails, and so on out of their standard office hours. Again, that should be determined in terms of your employment handbook and also your policies as well. The working from home, an extension of that, the Working from Home 2020 bill is coming down the tracks. We were originally told it may be in Q3. It's more likely to be Q4 or actually Q1 of 2022 at this point before that actually comes in. But that will give people the right to request the right to work from home. So there was no right under previous circumstances where people could look for officially the right to work from home. Now they will have the right to request it, and employers will have to give what we call reasonable justification in terms of why we would actually decline that request. Particularly more difficult if somebody has been working at home for us for the last 18 months, then suddenly we turn around and say, well, you know what, it doesn't really work for us. We would really have to show some kind of proper justification why that wouldn't be the case. Now, obviously, it's clear that there's some occupations that it's not fit for purpose. And if, we just have to provide that justification. Another change that's coming down the track as well is statutory sick pay in 2022. Again, that will be for 3 days at a rate of 70% of the salary, up to a maximum, I think it is €110. So that's just another element that's changing. So constant changes in terms of legislation and what's coming to us as employers, particularly where it's 3 days next year, 5 days the year after, 7 days the year after, right up to 10 days projected for 2025. So there's some changes. They're the things that are different. Obviously, some things are still the same, and that is we still have a contract of employment. So it's not all one-way traffic. We still have a contract of employment with our staff. As we mentioned a moment ago, we reserve the right to have our staff come back to work, to the workplace, as long as we have fulfilled our obligations as employers. So the employee has a duty and an obligation to attend for work if they want to remain employed with us. So that's important to note as well. So employers must follow reasonable requests as per their contract of employment and also as per their employment handbook. And they have their own health and safety obligations. So they need to do everything in their power to make sure that they are doing everything from a health and safety point of view that wouldn't jeopardize themselves or anybody else, while the employer has the obligation then for the staff in general. So quick overview, I suppose. Here's some questions that you might want to think about just as we go through the session for yourselves and see where we are. So are you planning to return to work? And if you are, when are you planning to come back? In what format? So are you going to look for everyone to come back on site? Do you foresee a hybrid situation for your workers? Or are you going to have people working from home? Is there a situation that might arise for some employers where they will want people to work from home all the time? And I'm going to come back with a question on that shortly. So what's your communication process around that? So how are you going to communicate that? Is it with agreement? Is it by diktat? Or how are you going to communicate that to staff and when? So giving people good notice that they're going to be coming back. There's no point in contacting somebody on Friday and saying, guys, we're all back to work on Monday. That's not going to work either. People have plans in place. People have, I suppose, issues that they need to resolve. And again, that will take some time. So we're trying to give people as much time as we can and to get their heads around it, to ask any questions, to go through any concerns, and then to put their own routines in place for that. So have you a remote working strategy? If your people are going to work remotely for you, have you got a remote working policy and strategy in place? So what's all the rules and regulations and the operating procedures around people who are working from home into the future? So how are you going to ensure a safe return to work? What are the kind of safety protocols are we going to put into place in terms of safety documentation, infection prevention and control, and so on, that we'll talk about shortly? Have you organized your COVID documentation? So things like a return to work questionnaire, is that complete? Maybe a COVID response plan, or COVID operating procedures. all of those contact tracing form. Have we got all those in place so that we're going to be compliant in relation to COVID? New operating procedures for COVID themselves. So have we outlined what they are? What's the new normal in terms of our working environment? Whether it's the canteen arrangements, whether it's bathroom arrangements, whether it's anything else, maybe our meeting rooms. Do we have to book them? Are we going to leave ventilation time between when we're booking the meeting room, for example? Meetings shouldn't go on for over 2 hours, otherwise that person becomes a casual contact. So are we going to make sure we avoid that in terms of the procedures we put in? How about simple question like, what's business travel looking like for us over the next number of months? Is it permitted? Are we doing it only on an essential basis? So all those should be identified at this point. Have we established our COVID response team? So do we have our COVID officer? How about our health and safety representative? Are they involved in the process? Our lead worker representative, so that person who liaises between the staff and management, have they received their training? Are they in place? And then anyone involved in communications or anyone else who's going to assist with that process. In terms of training, we might talk about things like the COVID reinduction. Have all your staff who are about to return, have they undertaken their COVID reinduction? Where we go through all of these details in advance of our return. And even if staff have been continuing to work all along, it's something that all of these elements are something that we should be considering now at the moment. How about issues, HR issues, for example, that might arise? And I'll mention these later on in terms of leave. Annual leave, in terms of requirements maybe to cover children who might be self-isolating from school. Have we covered all of those? And then for crisis management, in terms of if a number of staff are compromised, how about absenteeism? How many staff do we actually need to have? And is there a situation whereby if we have X amount of staff, then we can't open the business, for example? So all of those just things to be considered as we go through. A couple of updates very, very recently, obviously. So the government advice in terms of the return to work. There's been a little bit of lack of clarity on that, and businesses were calling for that for a number of weeks when we first heard the whole aspect of returning to work in September. So the current advice given is that until the 20th of September, we continue to work from home where we can work from home. From the 20th of September onwards, people can return on a need-by basis, on a staggered basis, where there's a particular business need. And then from the 22nd of October, then we return basically to work. So the whole aspect of having to work from home and the requirement to work from home from a government advice and healthcare advice point of view will be dispensed with, and we are to return to work on a cautious base where we actually want to do so. So that's where we are as employers. That's the government advice that's given, and that's what a lot of people are looking to follow. I'm very aware, and it will be the same for our own staff, that we're already back to work. So we have the office open and we have our own policies in place in terms of how we've come back to work. So for our own point of view, we have a Team A and a Team B situation. So Team A come back on Monday and Tuesday, Team B come back on Wednesday and Thursday, and then we cover the office by rota on a Friday. That's just how we do it ourselves. We don't allow the mixing from Team A to Team B. So if someone is on Team A, they can't come in on Wednesday and Thursday when Team B are in. And that's the whole element of making sure that other people aren't compromised. And if there was close contacts and if there was positive cases, that the whole staff wouldn't have to self-isolate, etc. But I'll talk to you a little bit more about that towards the end of the session. For a little bit more advice and guidance, I suppose, on all this area, we have the protocol for returning to work. So that is the protocol came out in, about May of last year, and has been updated several times since. And you can see exactly there the link. And when this is sent around, you'll have access to that PDF, and you can go through a little bit more detail. Huge amount of content on there. There's about 65 or 66 pages in total of detail. All around returning to work safely. And that's what it was all about in terms of returning to work on a risk assessment basis and safely. Okay, here's the next question I had for you. Can I ask my staff as to their vaccination status? What do you think on that? If I get you to vote on that one, please. So yes, no, or not sure. Can I ask my staff as to their vaccination status? What do you think on that one? Is it a reasonable question for me to ask my staff? Okay. And we'll see what we got. Okay, so 11% say yes, we can. 84% said no, and 5% went for not sure. Okay, so the advice that we have in terms of our employment law experts will be that no, we are not entitled to have that information. It might seem a bit unusual that our local restaurant can ask us or our local hotel can ask us that information, and we have to indicate our vaccination status. But as an employer, we don't have the right to ask for that information. And that goes on in step, even if people were hesitant about coming back to work, and if it's on the basis that they're not sure of other people's vaccination status, we are not at liberty. We don't have the right to know that information, And certainly, even if we did have the right, we wouldn't have the right to disclose it under GDPR. So general data protection regulations and data privacy laws will mean that we cannot ask and we cannot pass on or divulge that information if we did become clear. If somebody wanted to give it to us, we're entitled, they can absolutely do that, but we don't record it and we don't hold or retain that data at all. So again, that can cause its own issues. People will have concerns, and you might hear of employees saying, well, look, I don't feel comfortable coming back to work because I don't know the vaccination status of other staff. Now, if you have everything done from a health and safety point of view, to kind of minimize all risk involved, then it will be a requirement. Maybe you may well put a requirement on that member of staff to come back to work. Alternatively, they may have to take leave, because you do have a right to bring your staff back once everything is done, the potential that possibly can be done to reduce the risk there. So we don't have the right to know around the vaccination status. So just be absolutely clear on that. That would put us into a difficult situation if we were to ask that question. Even under GDPR, two other elements come in, one of which I'll touch on later on. But even in terms of the health questionnaires, we're actually being advised by the Data Protection Commissioner's Office that when we get that information back in terms of the questionnaires, we should take a note of any issues involved in those health questionnaires, but we should not retain that data either. Okay, same with the contact tracing details. We should hold on to contact tracing details. So from an individual's point of view, all your staff are required to take close contacts, to record close contacts of themselves. So for example, if someone came to their desk and they were talking to them for 15 minutes and they were less than 2 meters away, then they should record that person as a close contact. And in the contact tracing that would follow that from the HSE, we would need to provide those details to the contact tracing team. So that's the contact tracing form. But again, once we hold that on for 30 days, we shouldn't retain that detail any longer either. So again, all around GDPR and data privacy, particularly around sensitivity on medical data, is important. Okay, a couple of things that we've already mentioned, these maybe to go around them a little bit more. So what strategy are we adopting? So as I said, are we all resuming on site? Are we have a staggered return? Do we have a team-based return? Are we working to a hybrid model? Or is everyone remaining off site? So I know a number of businesses and large multinationals who are given the opportunity to people to work from home long into the future at this stage, and they're working on remote working strategies, etc. There's some other queries, I suppose, about whether people might have to work from home on a long-term basis, and maybe requirements on that I'll ask you about in a moment. So for example, are we having to change working conditions? Are we looking at our employment handbooks in terms of what that says? Probably need to be updating those at this point, especially if there's going to be hybrid working in place. We need that hybrid policy. And contracts of employment. So generally speaking, the contract will say to somebody that your typical place of work is going to be at your workplace, at your registered office. Now, maybe that's going to change. Is it going to be on a team base? Is it going to be a remote? Is it going to be a hybrid situation? And again, looking at our contracts of employment in terms of that around that area. We'll come back to some more about that in a little while. So when are you going to return, and how are you going to communicate that to the return, giving people sufficient notice so that they can actually return and plan for that and prepare for that return? We know from the 22nd of October, for example, that the government advised that we should continue to work from home. That will be discarded with, I suppose, and dispensed with, and then we're entitled to come back once we have all the health and safety and other requirements met. So again, we can give people a little bit of notice if that's our return time. So we're constantly working on a risk assessment basis, as I said, both for staff and for individual employees as well. So for general staff, all their health and safety issues, the COVID response, COVID risk assessments, and then in terms of individuals, is there a particular requirement why somebody, even with regard to everything else that we've done, might not return to the workplace given an underlying health condition or something else like that? So from a facility management point of view, as you can imagine, there's huge onus on us to make sure our facilities are prepared for when people come back. So take, for example, capacity limits. So in terms of the building itself, how many people can we realistically hold? For the moment, we're still working on a 2-meter distancing. Now, there's some suggestion that that may decrease to a 1-meter distancing, which obviously would have a huge impact on capacity limits and capacity planning in terms of the building, in terms of the office, in terms of the meeting room. So at the moment, we shouldn't be in a situation where people are 2 meters, are less than 2 meters from each other in a meeting room. So capacity limits are impacted by that. Also in canteen areas, for example. So are we going sitting down? Are we moving chairs away from each other and moving tables, configuration? So capacity limits are one thing. Signage, have we got our signage in position? So signage might mark out physical distancing. They might mark out the symptoms of COVID. They might mark out the capacity, floor markings, one directional arrows, for example, queue management. All of that will be done with signage typically. Physical distancing. So our signage again, and the configuration of elements, like I said, maybe canteen tables, might be office. So if we're sitting in an office environment in pods of 4, question I was often asked a few times when we did some COVID audits for companies will be in terms of, if I'm sitting diagonally across from somebody, is that within 2 meters? And it just depends on the setup and depends on their capacity. It also depends on, 1 or 2 times, standing desks have come up. If I'm at a standing desk and I don't have a perspex screen or perspex barrier and I'm going to be over somebody else, is that reasonable at the moment? Given the current requirements, I would say probably not, that we would look for some separation or barrier to be there. So certainly we want sanitizer, we want wipes, so we want our hygiene stations set out. They should be on desks available to staff, in small bottles, maybe in sanitizing wipes, and also then in common areas as well. So we can wipe down things like, for example, light switches, microwaves, door handles, handrails, all the different things that people are going to touch very often. They should be cleaned and cleaned regularly. So the PPE we might require, so we'll all want masks. So our own COVID operating procedures will say that when we stand up from our desk, we're wearing masks. When we walk around common areas of the building, we're at masks. The only times we don't wear masks are when we're sitting down at our workstation or when we're in the canteen area. That's our own ones. Again, it's down to each organization to determine their own COVID operating procedures. And we've been doing a lot of work on that for companies, both in terms of the audits in advance of staff coming back, and then also on COVID operating procedures and COVID response plans. And I'll talk to you about that in a moment. So gloves, typically not required. And then aprons, typically required. Gloves and aprons will typically be required for first aid. So they're requirements in terms of what first aiders would use for infection prevention and control. For separation, we're looking at perspex screens, partitions. So if we can't get that 2-meter distancing, what are we going to do in its place? And that will be allowance for maybe what we call sneeze guards, bit guards, for example, between people, normally made from polycarbonate or perspex, and they tend to work very well in areas or hatches where people might be dealing with other employees, like a reception desk, for example. Ventilation, air quality systems. So again, do we have openable windows as it comes into the winter? As we know from schools, that's very challenging. That can cause some other issues, I suppose, coughs and sniffles, and that might be, replicated right across from COVID symptoms then. Air conditioning, do we have aircon systems? Are they well serviced? Are the filters clean on those? And then air purifiers. So in our own office environment, we would have purchased an air purifier there, a HEPA filter, and they can be useful then as well in terms, as I can show on the diagram there on the screen. And they will show what's the air quality, and it will also clean the air quality as it goes as well. So things like that might be useful for ventilation. And again, sometimes it's just about making sure staff are going to feel safe and that feel everything has been done for them in advance of them coming back to work as well. So cleaning regimes, how often are we cleaning the common touch points? So if do we have a contract cleaner in our office typically, or is it down to staff to clean? How frequently are we going to do that? So is it in mornings, is it lunchtime, is it in the afternoon? And is there any kind of deep clean, or how often are we cleaning common touch points that I mentioned earlier on, like light switches, like fridge doors, like all the different things, that kettles, like all different things that people are likely to touch. For example, most people are bringing in a situation where you will be bring your own in terms of cutlery, bring your own in terms of canteen requirements. So that we're not sharing anything, we're not sharing knives, we're not sharing forks, we're not sharing cups. So again, that would be a good idea as well. Access and egress controls. So how are we limiting people coming into our work environment? Visitors, contractors. Make sure people are only there who absolutely need to be there. So are we having people, in the good old days, Optima training might be knocking on your door, we might be dropping in brochures. Is that reasonable over the next number of months? I'd say probably not, and people would have probably an issue with that. So again, making sure we kind of limit access and egress, visitors and contractors. And then our isolation room. So we're required within the return to work protocols to have an isolation room. And that's to make sure that if we do detect symptoms, that person can go there to that area. And again, there's going to be stocked with PPE, it's going to be stocked with sanitizer, and it's going to be confidential. So that person can go there until they can get out to home. Typically, we're finding that they're they're used very infrequently. So most people, if they develop symptoms while they're at work, they will go home on their own devices, especially if they traveled. It's only maybe if someone has traveled via public transport, or somebody younger, like in schools, has been dropped to an area, somebody older, maybe in healthcare, where that isolation room might be used. But certainly we have a requirement to have access to one of those. Okay, working from home, Paul. Do I have a right to tell my staff that they must work from home exclusively into the long term? What do you think of that? Do I have a right that I tell my staff that they must work from home all the time? What do you reckon there? So I know we might have from time to time. We might work in a hybrid model, but what if I decide, you know what, I have a small office environment. It makes sense for me. I can take on more staff and I can get them to work from home continuously into the future. What do you reckon? Okay. 17% say yes, 72% say no, and 11% say not sure. So that's great. Okay, the way I would look at this is I have the right to ask my staff to work from home into the long run, but do I have the right to force staff? Again, they have contracts of employment in place already. That contract of employment most likely tells them where they're going to be working. And if I was to change that, their long-term work base into the future, that is something that would have to be done via the contract of employment. Also have to change my employment handbook, but typically the contract of employment. A lot of what happened over the last 18 months was done on obviously a pandemic. It was crisis management basis. So people did emergency response and they worked from home. And it worked out for probably quite a lot of people. It worked out for the employer. We were still able to continue to work in certain industries. And then the employee was still able to earn a living for that period of time. But again, our plans into the future, post-pandemic, must mean we would need to be changing those contracts if we wanted people to continue to work from home into the future as well. Okay. So other things that we might look for. So in terms of health and safety, what are we doing? So we would need to undertake our safety audit for our premises, look at our safety statement and our risk assessments, look at our safety procedures. So we would undertake safety statements and risk assessments for businesses as well who are looking to return to work. So what are the safety statement? Safety statement or safety policy should be updated annually, so every single year. So what might have been in a risk assessment 2 or 3 years ago certainly would be very different from what's in a risk assessment now. There are other things even that would have changed in 2021 that would impact the safety statement. Take, for example, new code of practice in relation to bullying and harassment has come into play as of January 2021 as well. So that and also our COVID risk assessment should be coming into play in terms of our safety statement. So different hazards are now in the workplace that hadn't been maybe when we last left the workplace. Safety procedures, our new standard operating procedures. Safety responsibilities, our managers, our safety reps, as I mentioned, our lead worker representatives, and all of our staff. So each person has a duty of care to know what their responsibilities are in relation to safety. So do all of our staff know what would happen in relation to safety incident? Are our managers trained up in health and safety in general? So do we have health and safety for managers? Do every staff know what happens in a situation where there's a first aid requirement, for example? Then infection prevention and control, making sure we have our sanitizer there, making sure we have our cleaning regimes. Our sanitizer having 70% ethanol or alcohol or a substitute which would be equally as effective in terms of sanitizing. In terms of our training, so what training do we need? Our COVID induction, so each person returning to work should have that COVID induction. Our lead worker representative should be trained. How many do we need? The rule of thumb is 1 per 40. So 1 lead worker representative for 40 staff. And then our COVID officers. The way I would normally look at this, there's nowhere in the return to work protocol as mentioned COVID compliance officer. But however, we need somebody with the decision-making authority to try and implement our COVID procedures. We then need the lead worker, who is that person who will liaise with staff and management about all things COVID and keep staff up to date as regards to general advice and guidance around COVID. DSE and ergonomics. So what's DSE? DSE is display screen equipment. That whole area of just when somebody works from home, that becomes their place of work. Now, when we worked in the office, for example, then our employer had an obligation to assess our workplace from a health and safety point of view. So display screen equipment and ergonomics assessments, making sure that where we work is fit for purpose. For example, am I sitting on a kitchen table, sitting on a kitchen chair, with our laptop down at desk level? Is the laptop at the correct height? Am I using what I have to the best of my ability? Do I know how to set myself up for 3 aspects we always talk about in terms of DSE, health, safety, and wellness? In terms of first aid, do we have first aiders on site? Do we have fire wardens on site? Are they all trained up as we come back to work? Remember, it might be 18 months since people were at work. Every 2 years, we need to get our first aiders trained and recertified. So is that recertification still to be done? Are they out of compliance? How about our fire officers and fire wardens? Are they still certified? Do they need to be recertified at this point? So there are all the different things we need to be looking at in terms of training. And then our ongoing compliance on things like manual handling. Again, are we going out of certificate? That can be done online, for example, or fire, working at height, safe pass, etc. Period of time where nothing has been happening, in terms of compliance like that for 18 months, we go back to work and we have to make sure that that is in place. Next question. Can an employer monitor the temperature of staff? What are your thoughts on that one? Can an employer monitor the temperature of staff on this one? What do you think? Yes, no, or not sure? Okay, let's see how we did on that in terms of the results. So 63% say yes, 11% say no, 26% go for not sure on this one. So a lot more went for yes on this particular poll. And that's because we will have probably seen it. We've probably gone into some of the large companies that we might have gone into over the last number of months we might be doing work for, would have to go up to a temperature station, we might have to just stand in front of the camera, and that will thermal scan us, and we get a little beep to pass on. So in theory, yes, an employer can monitor the temperature of staff. However, under GDPR, we're told we must do what's under what we call a DPIA, a data protection impact assessment, if we're going to record and store medical data like that. So what's the potential risk of holding that information? Who's going to hold it? Who's going to store it? Who's going to log that information? Who's going to have access to it? Who's going to delete it? All those obligations under GDPR. So our own policy, in terms of our own workplace, and again, we're relatively small employers, suppose with 15, 16 people, will be that we provided a thermometer to our own staff a number of months ago, back a significant amount of months ago, and it's their obligation to record their own temperature at home before they come to work, and again, not come to work if their temperature is more than 38 degrees or they detect any other symptoms whatsoever. That's our own policy, but some companies will take temperature on site. Some companies will look at, and organizations will look at thermal scans, and they will put a huge amount of budget into temperature monitoring. Just remember, some 40 to 50% of people who go for a test and are diagnosed as positive with COVID had no symptoms whatsoever. So they were essentially asymptomatic. They had no symptoms. So that's the issue, I suppose, for people. There are a huge amount of people potentially going around carrying the virus that don't necessarily know they have it. But where we can identify symptoms, there is a requirement on us to actually, within the COVID response, that we have to take prompt identification and then isolate people who are potentially infectious. That's a requirement that we have under the return to work protocol. So we need to make sure that we raise awareness of what the symptoms are. So we do that with signage, whether it's on a monitor maybe, or it's just on static signage. Temperature monitoring, if we're going to do it, when are we going to do it? Is it on arrival? Are we going to do it with a person with the kind of little handheld thermometer? Are we going to do a camera thermal scan? In terms of GDPR, we've got to make sure we're not holding or storing that information. If we are, there's significant GDPR concerns around that we need to get over in terms of a DPIA, data protection impact assessment. Making sure we have our COVID detection response procedures. So how do we go about it, and what happens after we identify somebody is potentially symptomatic? Somebody has the symptoms, what happens to them? We go to the isolation room. We try and get them home as quickly as possible. We recommend that they go to their GP, contact their GP. Their GP will advise them then whether or not they go for testing, and so on. And that process continues from there. Some organizations will be looking at a system with how will we know that somebody has contacted their GP? How will we know if they've been required to go for a test? How will we know what the test result was? Within your COVID operating procedures, because you need to identify your own rules around that for your own staff, what they need to advise you of if they have a positive case. For example, at the very, very start of COVID, employers were being told by the HSE directly, that somebody in their organization had a positive case. Under GDPR, that stops. Now we're relying on our staff to let us know that they've had a positive case. In our own situation, we look to see whether people have, have a COVID test, and also what's the result of that COVID test. And again, we don't retain that data under GDPR. Contact logging and tracing, as I said, we have a requirement to make sure that if we're in close contact with somebody, and then there's a positive case in the company, the contact tracing team will be looking for that information. That simply would normally have one sheet, a little form that each person will have. They hold it themselves personally, and they keep a track of that for 30 days. And again, they dispose of it after that period of time. So managing return to work then for positive and negative cases, how are you going to rely on that? If somebody has a positive test, how long after that are you going to have them return to work? If somebody is symptomatic and they have a negative case, how shortly after that are you going to permit them to return to work? And it's generally 10 days if somebody has a positive case, 14 days if somebody is a close contact, or in terms of negative cases, it's generally about 48 hours after the last symptom when people will have people come back to work. But again, this is solely down to your own COVID operating procedures in terms of what you identify. That's normally a document that might be 4 or 5 pages long in terms of all the different things and how you're going to work all things COVID. So again, Where people are vaccinated, there's a slight difference in that, and I'll mention that to you just coming up on the next slide. So right at the moment, current guidelines in terms of self-isolation are, if you have symptoms of COVID, even if you're vaccinated, then you should self-isolate. If you're waiting for a test or if you have a positive result, you should self-isolate. If you've arrived into Ireland from a red list country, and I've included a link there to the countries, you should self-isolate. And if you're a close contact of a positive case, you should self-isolate as well. Now, there's some variation to that in a moment. You can end isolation if you have symptoms of COVID and your test was negative. You continue to self-isolate until you've been asymptomatic or have no symptoms, should I say, sorry, for 48 hours. If you were a close contact, you still follow the advice for close contacts. You restrict your movement for 14 days, and that's even if your test comes back negative. Now, again, you will actually rely on the HSE in terms of the advice that they will actually give you, but this is the general advice being given. Now, variation from that would be vaccinated close contact. So if you're identified as a close contact and you are vaccinated, fully vaccinated, that is your 2 vaccinations or your 1 vaccination, plus 7 days, and you have no symptoms, you don't need to get tested or you don't need to isolate. Okay, so that's the difference there for vaccinated close contacts in particular in relation to the government advice and guidance. Okay, we've just a couple of bits to go. Can I require my staff to take annual leave at specific times? So can I require my staff, just a poll question coming up, can I require my staff to take annual leave at particular times? Yes, no, or not sure on this one. What do you think on this one? Okay, so we can see how we get on that. And we can share out the result there with you there in a moment. So, sorry, there's just not coming up for a minute. We're having a little bit of technical difficulty with the polls this morning, so apologies on that.
I just said I'd allow a little extra time for people to vote there.
No problem at all, no problem. So can I require my staff? So can I enforce annual leave? Okay, 70% of people saying yes, 20% of people saying no, 10% of people saying not sure. It's an interesting question because one thing that we find as people have been working from home, a lot of employers will find this, a lot of HR professionals will find this, that there has been, I suppose, a huge amount of annual leave accrued and built up over time because as people were working from home, and, you know, to be absolutely fair, there was very few places we could go. We were, at times we were choose to stick to 1 kilometer, 5 kilometers. It wasn't exactly encouraging too many people to take annual leave. So people were, you know, holding as much annual leave as they could and taking fewer days. What we are finding as people return to work in September, you know, October, we have a buildup of annual leave, and there is this, I suppose, issue in terms of taking all of that annual leave and how we can do that. Now, generally speaking, you know, that's just open communication and dialogue between the employer and the employee in relation to annual leave. You normally set out your annual leave entitlements and policies in relation to your employment handbook, and that might not vary whatsoever. However, in specific situations where there is actually a requirement to use that annual leave, you can, with 30 days notice, enforce annual leave on employees, you know, for when it suits the business, down to business conditions. Not something generally that a huge amount that will be done quite significantly in some industries, but it might be something that will have to be looked at in terms of going forward over the next number of months. Again, also people's, you know, having this coming back to work and then having a serious buildup of annual leave may require people to be off-site then for a huge amount of time between now and the end of the year. So you just need to look at your own annual leave entitlements and your own annual leave policies, and it might need a little bit of variation in relation to that in terms of maybe there might be more days being able to be carried over, for example, on your policies if there's some flexibility around that as well, which is what we would have done in the last year or so. So just a couple of other considerations just before we finish then. So apart from the health and safety and the COVID issues in particular, some other considerations might be around HR issues in particular. So we mentioned earlier on, people coming back to work are going to have an amount of anxiety. It's going to be different, I suppose, you know, provisions that they're going to have to make for themselves in terms of coming back. So things that we would look at, the employment handbook and our policies, have they to be updated based on maybe it's whether it's a hybrid working model, whether it's remote working, whether it's display screen equipment and ergonomics, how are we risk assessing where people are working? And in terms of DSE assessment projects that we would have worked on for a number of our clients, find a huge variation in terms of some people working in a fantastic dedicated office environment at home, other people sitting at a kitchen table and a kitchen chair, you know, with just a laptop, for example, no keyboard, no, you know, all of this can happen. So again, that we have a duty of care as employers if we have people who are working from home, that is their workplace, and the same law applies in terms of the Safety, Health and Welfare Act applies equally whether somebody's working at home, working in the office, or working off-site. Same issues apply. Remote working policies. So have we done that? If we are going to have people working from home, we must outline our remote working policies. And again, we've been doing a bit of work on that for some companies. The right to disconnect, we mentioned it earlier on, since the 1st of April, again, coming back to that, our expectation on people to be contactable, answering emails, answer phone calls on a routine basis out of hours. Be very mindful of that. And again, the right for that person to go to the WRC, the Workplace Relations Commission, in relation to that. So just being aware of those HR issues. Long COVID. Again, people who have had COVID, people who might be struggling in relation to, their own illness, and issues are revolving around that. We've be conscious of that in terms of our leave arrangements and leave entitlements around that. So our expectations around what people might be able to do, and that's something we need to consider. Child mining, isolation, absenteeism, all those are likely to be issues that we'll find from a HR point of view. So where people have to isolate themselves as a close contact, where people might have children or other family members isolating, or might be identified as close contact within their own household. So all those issues are there to be resolved, and I suppose we need to do that, I suppose, through communication and also through our COVID operating procedures. Annual leave and travel. So we mentioned annual leave a moment ago, also travel. For example, do we know where our staff members are going? Do we have a right to know where our staff members are going? Our own policy is that staff would advise us for the moment until such time as we change that, if they are going to a country outside of Ireland that might have restrictions in terms of their return, so that we actually know. And there was anecdotal evidence from places where it would say staff members had been away, nobody necessarily knew where somebody was, and that person should have been potentially self-isolating and actually quarantining when they came back. So any of the red list countries, people should not return to the office to other members of staff. And sometimes those issues will arise between staff, because somebody will know somebody else has been away, whether it has been communicated or not, and issues can arise around that. So what's your policy around foreign travel, and whether there is a requirement to advise people if you're undertaking foreign travel, particularly to a red list country where there's going to be requirements on restrictions coming back in. Dealing with safety concerns. So where somebody has legitimate safety concerns, how do we address that? And again, down to our lead worker representative. If our member of staff has safety concerns, they address them to us. Obviously, we should communicate, and we should try and address those concerns, or highlight what we've done to try and alleviate those concerns and reduce the risk. If there still is an issue, obviously that person can talk to their health and safety representative. They can also talk to their lead worker representative. And lead worker is a protected position, I suppose, and they can actually try and communicate that to the HSA if necessary, if we're finding that some employers, which should never be done, but if some employers were to try and take those concerns not very seriously and not maybe implement any of the COVID responses. And we've heard of that being done in particular organizations where very little seemed to have been done in preparation for people's return to work, or any concerns that were made by staff weren't really being addressed. So there is I suppose a role there for lead worker representative in terms of communicating that onto the HSA and looking for an audit, for example, or something like that, or an on-site visit if need be, if that wasn't being done. Managing a remote workforce, again, something else to be considered if we are going to have people working from home into the future, in terms of how are we continuing to assess performance and productivity, efficiency, and then the requirement, if we have people working from home, to look after their wellness, to make sure their workspace is risk assessed, and then in terms of equality, to make sure we're not discriminating between people who are working in the office and working away from the office. It's very clear in terms of the return to work protocols that equality is a huge issue in terms of equality of promotion and equality of anything else, and that any discrimination wouldn't be tolerated between somebody who's working in the office in terms of any kind of career progression, for example, whether you're working in the office or working remotely. Finally, then succession and contingency planning. So again, if we have people who are leaving their positions, if we're in an organization, and we've seen this quite a lot, for people who have to have people on site, we are seeing some transition to more flexible arrangements where organizations are allowing people to work in a hybrid situation. As I said earlier on, 86% of people are looking for that option to have. And again, do we have succession planning? How are we in terms of staff movement? How are we going to replace staff? We may look at that. And then contingency planning in terms of any kind of upcoming emergency, again, if the next variation was to come in terms of COVID or any other virus, how are we actually set at this point? So a lot of the controls and the processes that we're going to put in place now to handle COVID and COVID response should be seen as a short-term stopgap, and it should be really looked at in terms of the long-term future. So whether it's the perspex screens, whether it's the sanitizer, whether it's the alcohol wipes, all of those may be with us for a long time to come. So again, not really a short-term measure, but more of a long-term measure to protect us against anything future that might come down the tracks to us as well. Hopefully it won't, but it's always a possibility. So apart from that, I just want you to thank you for attending the session. I know that we're going to take some questions now, and then Caoimhe is going to wrap up on the session itself. So I'm just going to have a quick look at the chat function and just see if any of the questions have come in. And if you haven't popped in anything and you feel like popping in any question, please do so. So just going to have a look down there and see if anything has come in. So Q&A, yep. Okay, question. Do we expect to be able to change from 2 meters to 1 meter from October the 22nd? That's my understanding. Okay, that is exactly my understanding, that the 2 meters requirement. So what we're being told, and this isn't gospel obviously, but we're being told that all restrictions will be removed from the 22nd of October. Now that can potentially change before the 22nd of October, depending on numbers and all the rest of it. But from what we're being advised, if all restrictions have been removed, then that restriction to go from 2 meters to 1 meter should be actually in place by then. Couldn't guarantee that obviously, but that's exactly my understanding. And that will make a huge difference in terms of capacity. In terms of how many people can we potentially have in the office, in the building, in meeting rooms, and all the rest of it will change significantly, both at work and obviously from a social aspect as well. That won't be in place either, so that'll be of some benefit. Any other questions that anybody has? And also what we'll be doing, we'll be sending out, I think, Caoimhe, isn't that right? You're going to be sending out the presentation and the recording, so people will have the opportunity maybe to revert at that point and ask a question if they have any issues as well.
Exactly, and like that, you have all your information there, Adrian. We'll also be sharing in the post-event comms. So if you do want to reach out to Adrian about any training sessions you want in-house or any specific questions, we can pass them on to Adrian, or you can contact him directly there as well. And like that, we will be issuing the recording of today's session. So if you do want to circulate it among your networks, please feel free to do so. You'll also find it on all our social channels and our website as well. And what we'll also do is link it to any relevant information we have there in regards to frequently asked questions we have within the membership. We've asked Hans to compile a kind of a listing there in terms of legalities as well. So we will issue that after today's session. I don't think there's any more questions coming in there at the moment. I think you gave us such a comprehensive presentation there, Adrian. You really kind of helped us navigate.
I think we might have bombarded people a little bit. There's quite a lot there to chew over, I think, and it's a matter of taking it one bit at a time, whether it's the health and safety measures, whether it's the COVID documentation measures, whether it's the training. There's a little bit to think about, a little bit to go through, and quite a good lot of content in 45 minutes, to be honest. But I suppose we just need to be aware of all the different things that we should be looking at in terms of this return to try and get people back safely. As I said, health, safety and wellness, 3 key areas as people come back to the workplace.
That's it, and you've definitely helped us so much with that today, Adrian. Thank you so much for preparing that presentation. We can also share the slides as well if that's of any help to anyone.
Of course, yeah.
Sure. Ask us as well. And like that, we'll be sharing all of the information for our lovely expert Adrian there today. So don't hesitate to reach out to get more info. Thank you so much, Adrian. And
thanks very much, everybody. Thanks for joining us. And thanks, Caoimhe.
Yeah, have a lovely day now.
Okay, bye now.